Hi everyone, welcome back to the Dark Mother podcast. My name is Emily Singh and I'm your host. In this podcast, I dive into some of the darkest issues that humanity faces today. We also explore any topic that is trauma or mental health related. I do this not to show you how messed up the world is, but to illuminate what is in the dark. You cannot even begin to heal or fix a problem if you're not even aware that there is a problem. Last week, we covered how to help a loved one struggling with schizophrenia, delusions, hallucinations, and bipolar. In today's part 2 episode, I will be going in depth on how to support a loved one struggling with depression, anxiety, and pre-menstrual dysphoria disorder, or PMDD for short. To begin, I'm going to share with you what depression is. For starters, there are many types of depression. In this episode, I'm going to be covering the types I have the most experience with. There's major depressive disorder, which I'm an expert in, having struggled with the condition since I was a teenager. There's also psychotic depression, situational depression, treatment-resistant depression, and PMDD, which is another condition that I've struggled with. The reason why there are so many different types of depression is because each one has a different cause. This is significant because that means doctors need to use different treatments. However, no matter what type of depression your loved one has, the support that you should give is going to be similar, keeping in mind a few exceptions. Now that you know about some of the different types of depression, let me tell you what it is. According to the National Institutes of Mental Health, major depressive disorder is a common but serious mood disorder. It causes symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. Like the NIMH says, depression is serious but also common. 38 million people in this country have been diagnosed with depression, and twice that number will be diagnosed within their lifetime. Depression has a stigma attached to it. Many people believe that it is a character flaw, that you can just snap out of it, that you can pull your bootstraps up, that it's not that serious. Many people with the diagnosis believe this themselves, which just adds a layer of shame on top of the depression. Helpguide.org, a nonprofit independent organization that gives advice and support regarding mental health, explains, depression is a serious condition. Don't underestimate the seriousness of depression. Depression drains a person's energy, optimism, and motivation. Your depressed loved ones can't just snap out of it by sheer force of will. Helpguide.org goes on to say, the symptoms of depression aren't personal. Depression makes it difficult for a person to connect on a deep emotional level with anyone, even the people they love the most. It's also common for depressed people to say hurtful things and lash out in anger. Remember that this is the depression talking, not your loved one, so try not to take it personally. Hiding the problem won't make it go away. It doesn't help anyone involved if you try to make excuses, cover up the problem, or lying for a friend or family member who is depressed. In fact, this may keep the depressed person from seeking treatment. Your loved one isn't lazy or unmotivated. When you're suffering from depression, just thinking about the things that may help you to feel better can seem exhausting or impossible to put into action. Have patience as you encourage your loved one to take the first small steps to recovery. Also, you can't fix someone else's depression. As much as you want to, you can't rescue someone from depression nor fix the problem for them. You're not to blame for your loved one's depression or responsible for their happiness or lack thereof. While you can offer love and support, ultimately recovery is in the hands of the depressed person. The NIMH lists symptoms of depression as follows: persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite or weight changes, thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear physical cause, and do not ease even with treatment. To gain an even deeper understanding about what major depressive disorder is like, let me share with you my experience. If you want to know about my experience in depth, you can listen to my episode Functioning with Depression and Anxiety. Today I'm going to just go over the main points. I've experienced depression since I was in middle school. I did not seek help because I thought it was normal since my mom was always depressed. My depression became even more severe when I was in high school. I had frequent thoughts of suicide. I felt like everybody would be better off without me. I felt unwanted. I felt like a burden on my family. One night, I decided to act on my thoughts of suicide. I decided I would go downstairs and take all the meds that were stored in the kitchen. Luckily, there were only different types of acid reducers in the kitchen, nothing lethal. I went back to my room in complete despair and felt hopeless. I then decided to distract myself with a book. That book happened to be Conversations with God. I started reading it and had an epiphany. I don't remember exactly what I read, but it was something along the lines that everybody deserves life just as much as anyone else. This is a thought that had never occurred to me. I had always felt so unworthy, so all of a sudden I was thinking, why does everybody else get to do what they want to do? Why does everybody else get to enjoy themselves but me? You see, I had never felt like I deserved to be happy. Can you see why I was so depressed? So now I didn't even care or not if I was wanted or not. I did not care if I was a burden because I realized if I'm a burden, then so is everybody else. I had just faced death, and now I was no longer afraid to be myself. I decided that I was going to be myself and go for what I really wanted, and not care if anyone was going to try and dissuade me or stop me. This epiphany really lifted my spirits for about 2 months. Then my depression came back. There was a point in my early 20s where I felt like I'd reached all my goals I had been working towards. Despite that, I felt so empty. I felt like no one truly knew who I was. I also felt like I didn't even know who I was or what I wanted anymore. I was so confused because here I was with everything I ever wanted and was not enjoying myself. I could not feel anything positive in my life, only the negative. I felt this feeling would last forever, and at this point I had only been taking my first antidepressant for about a week. Also, I was extremely suicidal. I'd been procrastinating suicide by spending hours and hours researching the best way. You see, I didn't want to end up surviving and disabling myself. Then there was the final straw. My sister was going out with her friends, and I asked to come along. She was surprised that I wanted to go, and told me that she didn't think that I would have a good time, which translated to me that I was not fun to hang out with. Not only that, but what she was telling me was validating a painful experience that I'd just gone through. I got invited out to breakfast with a bunch of nurses from work. One of the nurses, who had never been friendly with me, called me out in front of everyone and said, "How come you don't talk very much?" I was mortified. I sheepishly answered that I like listening. You see, I was a very high-functioning person in a lot of ways, but this time I was having trouble with my social skills and connecting with people on a deeper level. So when my sister told me in so many words she did not want me to go out with her, it was the final straw. I had met all these goals in my life so that I could help other people, and here were these people that I was trying to help treating me so poorly. I felt like things were never going to get better and that everyone would be happier without me. So I attempted suicide. When it was not successful, I went into the deepest depression I had yet. I was hospitalized. When I came home, all I did was stay in bed for months and go to therapy. In the following 2 years, I checked myself into the hospital 2 more times and also participated in 3 partial hospitalization programs. Not only did I have major depressive disorder, but I also had treatment-resistant depression. Now let me tell you about the support that I received that was helpful. When my dad first heard that I had attempted suicide, he flew home from his job in Alaska right away. He had no idea that I was even depressed. When I came home from the hospital, he stayed at the apartment my sister and I were renting together. I felt so ashamed of myself. I did not want to leave the house. I could not bring myself to go to work. My dad took over my portion of the rent. He would come visit me in my room. He would encourage me to exercise with him. He would take me to my appointments and even sit in the waiting room while I was in therapy for an hour. He was doing everything he could to help me. I had no idea that he would react that way. I thought that he would be ashamed and embarrassed of me. Some days I did not want to get out of bed, and my dad would be understanding of that. Often he would try to get me to at least come into the living room to watch a movie together. The best way that my dad supported me was that he never made me feel that he was ashamed of me. He never made me feel like I was lazy or unmotivated. The next best way he supported me was that he was present with me. He would check in with me. He would talk to me. He would try to get me to do simple things like watch movies with him. The third best way he supported me was going to appointments with me. The way my dad helped me was specific to my needs. Everyone will require support attuned to their own needs. Helpguide.org suggests, provide whatever assistance the person needs and is willing to accept. Help your loved one make and keep appointments. Research treatment options and stay on schedule with any treatment prescribed. Have realistic expectations. It can be frustrating to watch a depressed friend or family member struggle, especially if progress is slow or stalled. Having patience is important. Even with optimal treatment, recovery from depression doesn't happen overnight. Lead by example. Encourage the person to lead a healthier, mood-boosting lifestyle by doing it yourself. Maintain a positive outlook, eat better, avoid alcohol and drugs, exercise, and lean on others for support. Encourage activity. Invite your loved one to join you in uplifting activities, like going to a funny movie or having dinner at a favorite restaurant. Exercise is especially helpful, so try to get your depressed loved one moving. Going on walks together is one of the easiest options. Be gentle and lovingly present. Don't get discouraged or stop asking. Pitch in when possible. Seemingly small tasks can be very hard for someone with depression to manage. Offer to help out with household responsibilities or chores, but only do what you can without getting burned out yourself. Out of all of the above suggestions, what helps improve my mood the most is leading a healthy lifestyle. My mood just feels so much better and my mind so much clearer when I'm eating a healthy diet, exercising, and practicing mindfulness. Helpguide.org also gives advice on what you can say to your loved one, which includes, "You're not alone. I'm here for you during this tough time. It may be hard to believe right now, but the way you're feeling will change. Please tell me what I can do to help you. Even if I'm not able to understand exactly how you feel, I care about you and want to help. You're important to me. Your life is important to me. When you want to give up, tell yourself you will hold on for just one more day, hour, or minute, whatever you can manage." Helpguide.org also includes what you should never say. This is all in your head. Everyone goes through tough times. Try to look at the bright side. Why do you want to die when you have so much to live for? I can't do anything about your situation. Just snap out of it. You should be feeling better by now. Now, let's talk about psychotic depression. Psychotic depression has all the same symptoms as major depressive disorder and also includes symptoms such as delusions and hallucinations. A delusion is a fictional story that someone believes to be true. For example, a delusion could be someone truly believing that they are being used as a test subject by the CIA and that government agents are following them. A hallucination is when you can see something that no one else can see. The support you're going to give a loved one with psychotic depression is going to be exactly the same as the above, and you are also going to take a few more very important steps. If you notice your loved one having delusions and hallucinations, offer to take them to the doctor. It is very important that the cause of these delusions and hallucinations are discovered. There could be an underlying medical reason. If your loved one refuses to go to the doctor, that is okay. As long as their delusions and hallucinations are not causing your loved one to make dangerous or violent threats, plans, or actions. A common delusion people have with depression is that everyone would be better off without them, and that suicide is the best option. If your loved one is suicidal, call 911. Also, if your loved one is taking or making dangerous or violent threats or actions, call 911. If you live in Washington State, you can request a designated crisis responder, or DCR for short, to come evaluate your loved one. Even if your loved one is refusing to get help, they will be taken to the hospital on an Involuntary Treatment Act, or ITA hold. If your loved one is not meeting criteria to go to the hospital involuntarily, the best thing you can do is be there for them. If they are telling you all about their delusions and hallucinations, then listen. Be curious, ask questions. It will do you absolutely no good to tell them what they are believing and what they are seeing is not real. All that is going to do is cause an argument and damage your relationship. Many people mistakenly think that they need to reorient their loved ones to reality. They think this will stop the delusions and hallucinations. It will not. Their delusions and hallucinations will not get stronger by you listening about them or questioning about them. The only way to stop the delusions and hallucinations is to get your loved one on the right meds. So please promote them going to the doctor as soon as possible. Now there are some exceptions to what I just said. Some delusions and hallucinations can be harmless. However, some can be harmful. For example, auditory hallucinations that instruct a person to go kill themselves or hurt another person should be dealt with differently. Obviously, if this is happening, call 911. Also, you should do more than listen. You should tell the person you do not need to listen to the voices. Do your best to ignore the voices. Do not let the voices control you. I'm here for you. I'm going to do everything I can to keep you safe from the voices. Also, if someone is having frightening hallucinations, be there for them. Tell them that you are there to protect them, that what they are seeing is scary, but Queensland Health, which is the public service in Queensland, Australia, recommends that you do the following if a loved one is experiencing hallucinations. Watch for cues that the person may be experiencing hallucinations. These include watching an empty space in the room, with eyes darting back and forth, speaking to an invisible person, talking to himself or herself, and appearing to listen to someone when no one is speaking. Directly ask the person whether he or she is experiencing hallucinations. For example, you could say, "Are you hearing voices now? Is it a man's or a woman's voice? What are they saying to or about you?" It is not appropriate or necessary to repeat this questioning frequently. It may be difficult for the person to concentrate on what you are saying because of the distraction of the hallucinations. Without being condescending, speak clearly and keep sentences simple. Do not respond as if the hallucinations are real. For example, do not argue back to the voices that the person may be hearing. Do not deny the person's experience, but suggest your own perceptions. For example, you could say, "I understand that you are feeling worried now. I don't see or hear anything, but I can understand that it may be difficult or worrying or unpleasant for you." Remember that a person who is experiencing hallucinations is often able to distinguish between the hallucinations and reality. In such cases, the person can understand the conversations you are having. Help the person to identify symptoms, symptom triggers, and symptom management strategies. For example, it may be helpful to ensure that the person has a well-lit room and that extraneous noises is kept to a minimum. Help the person to cope with auditory hallucinations by providing diversions. For example, you could make conversation or undertake simple projects or physical activity with the person. Help the person to compare his or her thoughts and ideas with those of others to see if the impressions are similar. Help the person to compare his or her thoughts is reality testing. Vaccinations can take weeks, even months, to diminish fully, even if the person does respond to antipsychotic medication. Once the person has responded to medication and other treatment, he or she can live a full and normal life. Encourage the person to look forward to this. Moving on, let's talk about situational depression. Situational depression is exactly what it sounds like. It is when you are stuck in a situation that is making you depressed. According to the National Association of Mental Illness, situational stress can generate emotional or behavioral symptoms that look and feel very much like clinical depression. Depending on the degree of symptomatic discomfort, the treatment plan for situational or stress-related symptoms may be supportive or psychoeducational in nature, and often includes the teachings of simple coping tools that can help combat the impact of everyday stress. Remember that certain types of anxiety and sadness are often a normal response to difficult or overwhelming circumstances. Here are some symptoms shared by situational stress and clinical depression. Situational depression could be caused by a situation that is out of your control to change. For example, if a loved one has gone missing, if a loved one has died, losing your home in a natural disaster, or losing a job. Basically, being stuck in any situation that you find distressing. Now, if the situation were to be reversed or repaired, the depression would lift immediately. The support you want to give in situational depression is going to be the same as supporting someone with major depressive disorder. What you can also do is brainstorm ways to fix the situation. That is, if it is fixable. Now, when the timing is right, the next best thing you can do is to help them move on into a new direction. Don't push or rush them in a new direction. Offer them alternatives when they are ready. Obviously, this won't work so well if they are grieving over the loss of a loved one. It is normal to grieve, and the only thing that will help is time and coping skills. However, if you are talking about some other type of loss, then we can focus on going in a new direction. Once your loved one has fully accepted their loss, ask them what it is they want to do now, and then support them in their new endeavor. The situational depression should lift with time. However, there is a possibility it could turn into major depressive disorder. Another possibility is if the situation that is causing the situational depression was traumatic, they might even develop PTSD. We'll cover PTSD in a bit. Quickly, I'm going to go over treatment-resistant depression. You're going to give the same support as you will to somebody with major depressive disorder. However, I'm going to offer some alternatives to meds as treatments for this, since treatment-resistant depression is resistant to pharmaceuticals. The first alternative I'm recommending is transcranial magnetic stimulation, or TMS for short. According to UC San Diego Health, TMS is a non-invasive technological breakthrough that involves applying a series of short magnetic pulses to stimulate nerve cells in areas of the brain known to be associated with major depression. The treatment for depression is sometimes called repetitive TMS because repetitive magnetic pulses are delivered. Studies have shown repetitive TMS twice as effective at improving symptoms of major depression than antidepressant medication and talk therapy. TMS is FDA approved, safe, and well tolerated, with no long-term side effects. Some people may experience involuntary eye blinking or facial muscle contraction during treatment. Others report minor headaches or mild pain at the stimulation site following treatment. These side effects usually go away within 24 hours. I've wanted to try TMS myself and still would not rule it out. I would consider it whether or not I had treatment-resistant depression because there are no long-term side effects. TMS for any type of depression and also a lot of other conditions as well. The reason why I have not done it is because at the time I was considering it, I could not afford it. However, I may try it out in the future. Another option for treatment-resistant depression is electroconvulsive therapy. I would reserve this option as a very last resort because there are some very serious risks. If you are skeptical, which you should be, I recommend that you watch Sharon Newland's TED Talk on his experience with ECT. NAMI explains ECT is a procedure where controlled electrical currents are passed through the brain while the person is undergoing general anesthesia. This results in a brief controlled seizure that affects neurons and chemicals in the brain. It is most often used to treat severe depression and depression with psychosis that has not responded to medications. In some cases of treatment-resistant bipolar disorder, ECT may be considered as a treatment option. Once called electroshock therapy, ECT still has many negative associations. When it was first used in the 1940s, it was very primitive. The reality today is different. People are asleep during the procedure and wake up 5 to 10 minutes after it has finished. They are able to resume normal activity in about an hour. Most people have 4 to 6 treatments before major improvement is seen. This is followed by additional treatments and in some cases maintenance ECT on a less frequent basis, such as once a month or once a year. The last type of depression that I'm going to go over is pre-menstrual dysphoria disorder, or PMDD. PMDD obviously only affects women. The easiest way to describe PMDD is like PMS on steroids. PMDD can cause severe mood swings that lead to impulsivity, suicidal thoughts, suicide attempts, homicidal thoughts, and in severe cases, violence towards others and even murder. I've been diagnosed with PMDD, and what often happens a week before my period is that I get severely depressed and experience suicidal thoughts. It's helpful knowing my diagnosis because when I get like this, I can remember, oh, it's right before my period, these feelings are going to pass. According to Massachusetts General Hospital Center for Women's Health, PMDD is a more severe form of premenstrual syndrome characterized by significant premenstrual mood disturbance, often with prominent mood reactivity and irritability. Symptoms of PMDD can emerge 1 to 2 weeks preceding menses and typically resolve with the onset of menses. This mood disturbance results in marked social or occupational impairment, with its most prominent effects in interpersonal functioning. A study found that women with untreated PMDD were likely to experience a loss of 3 quality-adjusted life years during their lifetime as a result of their premenstrual symptoms. This did not include menstruation-free periods such as pregnancy, breastfeeding, and menopause. PMDD affects 3 to 8% of women in their reproductive years, with symptoms usually emerging during a woman's 20s. These symptoms may worsen over time. For example, it has been observed that some women may experience worsening premenstrual symptoms as they enter into menopause. Less commonly, PMDD may begin during adolescence, with case reports suggesting that successful treatment options in adolescents with PMDD are similar to those used for adult women. The major risk factors for PMDD include personal history of a mood or anxiety disorder, family history or premenstrual mood dysregulation, stress, and age in the late 20s to mid-30s. Psychological symptoms include anxiety, feeling overwhelmed or out of control, increased depressed mood, irritability, mood swings, sense of feeling overwhelmed, sensitivity to rejection, social withdrawal, sudden sadness or tearfulness. Physical symptoms: abdominal bloating, appetite disturbance, breast tenderness, headaches, lethargy or fatigue, muscle aches or joint pain, sleep disturbance, usually hypersomnia, meaning you sleep too much, swelling of extremities. Behavioral symptoms include fatigue, forgetfulness, and poor concentration. The support you should give to someone with PMDD is going to depend on how it's presenting. If your loved one is presenting as depressed, then give the support you would give to someone struggling with major depressive disorder. The nonprofit organization Mind, that gives support and advice on mental health, suggests plan around their monthly cycle. PMDD symptoms happen at specific times in the menstrual cycle. If you can predict when the symptoms are likely to start, you may want to plan things in advance that might help. For example, you could schedule time to help with daily chores, plan activities that may help them to relax, make sure that people will be around to offer their support. It might also help to avoid planning any activities during that time that they might find difficult. Support them to seek help. Supporting your friend or loved one to seek help can be really important. It can help to remind them that PMDD is a recognized condition like many others and that they deserve treatment and support. Not all healthcare professionals are aware of PMDD or fully understand it, so people can sometimes face barriers to getting the treatment and support they deserve. Knowing that you're in their corner to support them could help them keep trying if they face barriers. You could even consider becoming their advocate. If they are presenting as argumentative and verbally abusive, then it is very important to set boundaries, de-escalate, and stay safe. If your loved one becomes violent towards others or themselves, then keep your distance and call 911 and ask for a DCR. Now that I've covered depression, let's move on to anxiety. Depression and anxiety often go hand in hand with each other. It's rare to be diagnosed with one without the other. I was diagnosed with anxiety in my early 20s, yet I had never considered myself an anxious person. The doctor was noticing all the symptoms of anxiety that I was having. She asked me if I was anxious, and I told her no. She said, "Are you sure?" And I was like, "Yep, not anxious." I was so out of tune with my body that I did not even realize I was anxious. At the time, I was getting chronic chest pain every day. I was always tense, on edge, and had shallow breathing. However, I thought that this was normal. I didn't realize that I was anxious. There are also many anxiety disorders, but in this episode, I'm only going to cover generalized anxiety disorder, also known as GAD. According to the National Institutes of Mental Health, usually anxiety involves a persistent feeling of anxiety or dread, which can interfere with daily life. It is not the same as occasionally worrying about things or experiencing anxiety due to stressful life events. People with generalized anxiety disorder, GAD, experience frequent anxiety for months, if not years. Symptoms of GAD include feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, being irritable, having headaches, muscle aches, stomach aches, or unexplained pains, difficulty controlling feelings or worry, having sleep problems, such as difficulty falling or staying asleep. Mine suggests don't pressure them. Try not to put pressure on your friend or family member to do more than they feel comfortable with. It's really important to be patient. Listen to their wishes and take things at a pace that feels okay. For them. It's understandable to want to help them face their fears or find practical solutions, but it can also be very distressing for someone to feel they're being forced into situations before they feel ready. This could even make their anxiety worse. Try to remember that being unable to control their worries is part of having anxiety, and they aren't choosing how they feel. Ask how you can help. Your friend or family member may already know how you can support them. For example, helping them with difficult situations, talking to them calmly, or doing breathing exercises with them. By asking them what it is they need or how you can help, you can support them to feel more in control of themselves. Knowing that there is someone around who knows what to do if they start to feel frightened or panicked could help them feel safer and calmer. Support them to seek help. If you think your friend or family's member anxiety is becoming a problem for them, you could encourage them to seek treatment by calling a GP or therapist. Offer to help them arrange a doctor's appointment. If they are scared of leaving the house, you could suggest they call their GP to find out if they do home visits or telephone appointments. Offer support when they attend appointments. You could offer to go with them to their appointments and wait in the waiting room. You can also help them plan what they'd like to talk about with the doctor. Help them seek help from a therapist. Also help them seek different options for support, such as community services or peer support groups. It can sometimes be really challenging to support someone with a mental health problem. You are not alone if you feel overwhelmed at times. It is important to remember to look after your own mental health too, so you have the energy, time, and space you need to be able to help. For example, set boundaries and don't take on too much. If you become unwell yourself, you won't be able to support them or yourself in the same way. It also is important to decide what your limits are and how much you feel able to help. Share your caring role with others if you can. It's often easier to support someone if you're not doing it alone. Talk to others about how you're feeling. You may want to be careful about how much information you share with the person you're supporting, but talking about your own feelings with someone you can trust can help you feel supported too. Now that we talked about anxiety, let's talk about panic attacks, because anxiety can lead to panic attacks. Mine suggests that you do the following in case your loved one has a panic attack. Try to stay calm. Gently let them know that you think they might be having a panic attack and that you are there for them. Encourage them to breathe slowly and deeply. It can help to do something structured or repetitive. They can focus on, such as counting out loud or asking them to watch while you gently raise your arm up and down. You could also do a breathing exercise on YouTube. Encourage them to stamp their feet on the spot. Encourage them to sit somewhere quietly where they can focus on their breath until they feel better. You should never encourage someone to breathe into a paper bag during a panic attack. This isn't recommended and it might not be safe. Thank you all so much for tuning in to part 2 today. I will be following up this episode with part 3, in which I will be sharing on how to give support to loved ones that experience PTSD and binge eating disorder. Remember, in this podcast, not only do we cover anything that is mental health and trauma related, but we also dive into some of the darkest issues that humanity faces today. We explore the darkness not to see how messed up everything is, but so that we can begin healing. You cannot even begin to fix a problem if you are not even aware that it exists. Please like, subscribe, comment, and share this episode in order to spread uplifting tools, knowledge, and skills. Also, if you have any thoughts, ideas, comments, or suggestions, you can email me at thedarkmotherpodcast@gmail.com. I respond to all messages every Wednesday. Thank you all so much.